Now, if you're like me, I would bet that you or someone you know has experienced this terrible process before. I experienced it 2 years ago when I injured the plantar fascia in my right foot playing soccer. The doctor told me two things. One, that I needed physical therapy to speed up my recovery process, and two, that I needed orthotics for my cleats to truly mitigate some of that risk of re-injury. Now, physical therapy was going fine, but what was so frustrating was that I could not find orthotics that fit me and fitted my cleats. So physical therapy ended, I was feeling great, and I decided that I didn't need orthotics, and 15 minutes into my next game, I re-injured the plantar fascia in my right foot. And at that moment, I made it my life goal to find orthotics that fit me and fit in my cleats. So there's three main problems with orthotics today. There's subjectivity involved in the analysis, meaning you could take the same problem to 4 different practitioners and get 4 different recommendations. Now there's also layered design approaches that are accustomed to the typical orthotics out there today. These layers result in a very thick orthotic, and ultimately they don't fit in your shoes and they're uncomfortable. And lastly, you go to see a practitioner or a podiatrist because your feet hurt. And the last thing you want to do is wait the typical 3 to 4 weeks to get your custom orthotics to fix your problem. So that's ultimately why I started Elevate. And we help orthotic practitioners provide the best possible care by using data, software, and 3D printing to create hyper-customized orthotics that actually fit. Now, the first problem I had to solve was that thickness issue. And to do that, I had to reimagine the use of foam entirely. Now, this new foam isn't actually foam at all. It's a hyper-customizable, 3D printed, elastomeric lattice structure. Or as my wife likes to call it, the rubber sponge. Now, this rubber sponge technology is an incredibly powerful tool because for the first time, it allows us to 3D print 100% of the orthotic. Again, this is something that has never been done before. And this is important because it gives us perfect control over every single aspect of the design. And by that I mean we have perfect control over the thickness, meaning we can combine those structure and comfort layers typically found in orthotics today into one thin layer and ultimately improve comfort. We have perfect control over the shape of the orthotic, so we can design orthotics that fit you and your shoes and ultimately increase your performance. And lastly, we have perfect control over the density in every single part of the orthotic, meaning we can add gait-corrected features without adding thickness and ultimately reduce your risk of injury. Now add to that our software that eliminates that subjectivity in analysis. It can analyze gait more accurately and consistently than a podiatrist, and it can generate more exact 3D representations of your feet so that we can design orthotics that perfectly fit. You add those two things together and you get the best fitting orthotic with the most accurate gait correction ever before, all in the industry's shortest lead time. So this is the team behind Elevate. Like I said before, I'm the founder and CEO. I have my bachelor's and my master's degree in mechanical engineering, where I studied 3D printing and structural mechanics. I have led multiple highly successful new product development teams for a multi-billion-dollar company. Daniel Miller, he's our 3D printing expert. He's a director at Carbon 3D, and Carbon is the company that developed the 3D printing technology that we're using today. Alex Pazzi, he's our IP strategist. He's a VP of technology for a company in Raleigh, and he has so much experience taking new product development ideas, protecting them, and ultimately successfully bringing them to market. And last but not least, Dr. Judy Foxworth. She's our team doctor, and she's also the director of the Winston-Salem State University's Human Performance and Biodynamics Lab. Now, we've also partnered with Winston-Salem State as a whole. They're helping us with the medical research and validation that we need to successfully and confidently bring this product to market. Now let's talk about that market a little bit. The global shoe insert market is expected to grow to $4.8 billion by 2023. And $700 million of that is spent annually in the US on custom orthotics. And that's our target market right there. Now this market has other players in it, as every market does. But what's so interesting is there's an inverse relationship between lead time and value. And by that I mean if you have a product with good value, typically the lead time is terrible. And that's what makes Elevate so polarizing, because for the first time, we have a product that has the industry's best value with the industry's best lead time. And that really helps us separate ourselves from our competition. We're also patent pending, so that helps us keep that distance between us and our competition. Now, our business strategy has three parts. First, we partner with practitioners. We don't compete against them. We realize that our technology can help practitioners do their job better and better serve their patients. Now, where do we meet practitioners? We meet them in industry conventions. We can publish medical papers, write articles in medical journals, and ultimately drive them to our website where they can find more information about our product and reach out to us and ultimately set up a meeting or a call. Now, once those partnerships are in place, we'll send them our 3D scanner and our gait analysis tools and train them on how to start collecting data from their patients. Once they start collecting data from the patients, that data is then sent to us, and we use it to develop and 3D print the orthotics and ship those orthotics back to the practitioners for test fitting. Now, right now, we're in our research and development phase. We're ultimately working towards defining our minimum viable product for our accommodating orthotic. Now, our gait corrective orthotic needs a little bit more validation and research, so we're going to run that in parallel with our minimum viable product and pilot program for our accommodating product. But the accommodating product allows us to get to market a little bit sooner and start generating more revenue. Now, the pilot program we're planning on launching in September of 2020. We're going to partner with 3 practices. We're going to use that time to identify workflow issues, get feedback on the use of our software and hardware, and ultimately use that feedback to get ready for launch in January of 2021. Now, we're really excited about January 2021 because we'll have partnered with 10 practices by the end of year 1. We'll be supporting over 100 patients a month. We'll manufacture orthotics right here in Winston-Salem, North Carolina. And to scale, we need to reach out and expand our reach to more of the 5,000 practices that exist in the U.S. Now, we have 4 revenue streams, but the main two revenue streams are the accommodative orthotics and the corrective orthotics. It costs us $100 to manufacture both of those products, and then in turn we sell them to the practices for $250 and $350. Then the practitioners can turn and sell those 2 products to the actual patients for $500 and $700, which is right in line with industry standard. So the first year, like I said, was going to be spent on research and development in our pilot program. Now, we're not anticipating any revenue for that first year, but in the second year, we'll have partnered with 10 practices. We'll be generating just about $500,000 in total revenue. And then 2 years after that, we'll grow and support 90 practices. We'll generate over $6 million in total revenue. And our gross margin will be roughly 61% of that at $3.8 million. Additionally, we'll be cash flow positive after 2.5 years. So the last 6 months have been incredible for us. We've generated so much interest from primary care sports providers from a lot of the big organizations here in town. We've been a part of this amazing Velocity program where we've grown so much. We're being considered for an NCIDEA grant. We're patent pending. And we have calls set up with 3 local practices that are interested in learning more about our pilot program. So the next step for us is funding. And the $25,000 that we get from Velocity will go so far because it will allow us to buy the software and hardware that we need to ultimately start prototyping, which is incredibly important for a product like this. We need to prototype early and often. In addition to that, we're raising $500,000 to complete our product testing, ultimately define our minimum viable product that we'll use to minimize the technical risk that's associated with our company right now. And also, we need to run a successful pilot program that we can use to ultimately launch our full operation and minimize the customer risk. So if you're excited about this and you want to join a company that has the potential to change the orthotic industry forever, please come and talk to me, and I look forward to the conversation.
Talk to me about your intellectual property protection.
Yeah, so right now we're patent pending, and we have the application of this 3D printed lattice technology patented for the orthotic industry. So right now we are, and we're also developing software. We haven't protected any of that software yet, but it's still in development. Yeah.
So I've got customer products, so I understand
Okay.
the problem that you've got.
Yeah.
And trying to fit in there. A lot of the space is taken up by the hard piece that's under my arch and under my heel. Is that still going to be there with your product, or do you also replace that piece as well? Because even just replacing that little thin layer of foam on the top of mine with your thin layer of foam doesn't seem like it changes the entire equation that much.
Right, so it's not just the foam we're replacing that structure as well. And we can 3D print it all in one piece and vary density throughout the entire piece, so we can make the part of the orthotic that needs to be stiff, and it's still connected to the foam part of the unit. So it's all one piece.
Mike, we might need to go back to the
Oh,
mic,
sorry.
'cause it's harder to hear.
Did everyone hear that? I can repeat it if you like.
No, we heard it.
Okay.
So-
Thanks.
so,
Yeah.
what is the source of your, the equipment for doing the